Hello, thank you for watching this presentation of Burnout in Psychology. This is a presentation by Rick, Adriana, and Fiona. This is a presentation by Rick Atherton. What has emerged from research is a conceptualization of job burnout as a psychological syndrome in response to chronic interpersonal stresses on the job. Three key dimensions of this response are overwhelming exhaustion, feeling of cynicism and detachment, and a sense of ineffectiveness and lack of accomplishment. Employees who experience burnout often experience impaired emotional and physical health and a diminished sense of well-being. This presentation will be split up into three sections of psychology and the effects of burnout. First, I will talk about clinical psychology, followed by Adriana, who will talk about counseling psychology, and lastly, Fiona talking about organizational psychology. We'll be focusing on the graduate psychologists and the effects of burnout as they transition into the workforce. At the forefront of burnout syndrome are people working in human services, which began to appear frequently in the 1970s and has only increased moreover in clinical psychology. A clinical psychologist's job is an especially stressful role emotionally and mentally, sharing the burden of mental health issues and trauma of their clients. Furthermore, postgraduate clinical psychology trainees have been identified as particularly susceptible to high levels of stress, making them more likely to burn out. For this section of the presentation, I will be covering the origin, reasons, interventions used to combat the occurrence of burnout syndrome and how this phenomenon affects clinical psychology and the postgraduate trainees. The first dimension I will talk about is exhaustion. It is clear through vast research that service and care can be an arduous occupation and that emotional exhaustion is a common response to such job overload. Rupert and Morgan found that clinical psychologists were more likely to develop an emotional exhaustion dimension of the burnout syndrome than any other profession. Peake identified one of the prime stresses causing exhaustion as ambiguity. Clinical psychologists are faced with ambiguity frequently. An example of ambiguity would be dealing with complicated mental health illnesses where the symptoms do not align with any diagnostic category, leaving the clinician and the patient in a situation of ambiguity with no diagnosis. This can prove to be a stressful environment for any psychologist, as their role and training depends on diagnosis and then intervention, especially student clinicians, as many are seen as obsessive overachievers who must learn to cope with not knowing all the answers to the problems that confront them. Other stresses which lead to exhaustion in clinical psychology include long hours, frequently switching between roles such as lecturing, tutoring, and researching, and being a therapist. Exhaustion is something that is not only felt, it causes reactions to push away from one's work to cope with overload. However, this can be displayed as depersonalization and cynicism. Cynicism and depersonalization is the unfeeling and callous response to the recipients of one's service and care. This can be characterized by the clinical psychologist putting distance between themselves and the clients by ignoring the traits and individualities that make the client a unique person. The client's demands are considered less troublesome when they are regarded as an impersonal object of one's work. This distancing is used by developing a cynical attitude when the clinical psychologist is exhausted. As clinical psychologist trainees are newer to this type of work, feeling overwhelmed will come easier. Cynicism will then follow for many as a coping mechanism. High levels of exhaustion and detachment from the job and clients signify that workers possess insufficient resources to deal with the demands of their jobs, leading to impaired job performance. Which brings me to my third key dimension, ineffectiveness and lack of accomplishment. Ineffectiveness. This is known as a sequential result from exhaustion or cynicism, or a combination of the two. In a clinical psychologist's role, the overwhelming demands of clients and work that create exhaustion and cynicism will wear away from one's self-confidence and sense of effectiveness, creating professional self-doubt. Furthermore, a clinical psychologist trainee or graduate's lack of experience would add to the stress of exhaustion, thus lowering their self-esteem. The result of self-doubt and ineffectiveness is detrimental not only to the clinical psychologist's health, but to the client's health too, with lower levels of effective service. Janot found that exhaustion at high levels and depersonalization were correlated with negative attitudes towards clients and patients. In turn, these attitudes have been linked with poor outcomes for clients and patients with severe mental illnesses. It is important to note that due to the role of a clinical psychologist, the stresses are inherent and unavoidable. Therefore, inevitably, clinical psychologists and trainees will endure some stress in their career. This being the case, it is important for individuals to learn self-care and stress management strategies to avoid burnout. Early reviewers divided stress management into two approaches: individual and organizational intervention strategies. Research has shown that variables such as excessive workload, time pressure, and role ambiguity are precursors to burnout. These factors are vital areas that organizational strategies address with such programs as the requirement to work with supervisors as part of graduate training. Working with a supervisor allows the graduate's needs and expectations to be managed with the support of a supervisory figure who can aid and advise. This type of intervention is one that helps the trainees ease into work with the support of some experienced professionals. Jones and Thompson found that supervisors provided a supportive figure and helped relieve certain worries at stressful times for the trainees. Supervision has been shown to be restorative in that it encourages emotional experiencing and processing, and formative by maintaining the trainee's competence and general effectiveness, which helps to combat all three areas of burnout. Job control intervention. A meta-analysis by Ahola found that job control was the most effective organizational intervention to reduce exhaustion and cynicism and increase effectiveness in the job. Limitations to working hours, working volume, increased autonomy, and decision-making gives clinical psychologist job satisfaction through a balanced system of work, life, and job demands. Spector found that high levels of perceived control was associated with high levels of job satisfaction as it counterbalances job strain and contributes to motivation. Trainees will find it difficult at first to maintain job control as their transition to the workforce can be dictated by requirements of supervisors and regulation requirements. Support group interventions. Socializing with like-minded cohort of psychologist trainees or joining support groups and networks has shown to build resilience. This type of intervention builds resilience through support groups of people that experience similar events and stresses. Jones and Thompson found that drawing encouragement and support from peers played a vital part in the way trainees combat stress and anxiety in training, which in turn reduced exhaustion and increased self-confidence. Having a cohort of clinical psychologist trainees allows for group reflection, support lines, and keeping a positive frame of mind, which both boosts confidence and motivation. Although individual-focused stress management approach has less of an effect on the way clinical psychologists deal with burnout, one intervention has become highly recognized in the prevention of burnout, which is the humanistic therapy and spiritual approach, more specifically, meditation and mindfulness. Murphy found that meditation and mindfulness programs were shown to be the most effective for clinical psychologists in reductions of all facets of burnout, and furthermore, in overall mood. Several studies have shown that beneficial effects in clinical psychologists regarding a variety of psychological states, including symptoms of general distress, anxiety, depressive symptoms, exhaustion, and quality of life. A study by Slayers found that meditation allowed for recognition of personal meaning and the development of gratitude, along with the reduction of emotional exhaustion and depersonalization, and an increase in positive perceptions of clients after 6 weeks of practice of meditation. Adriana will now discuss the effects of burnout on counseling psychology.